Have you ever wondered how long most men typically last in bed? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to discuss the average time it takes for ejaculation based on scientific research. If you're new to this channel, I share urology-related content every day. So if you enjoy what you see, be sure to subscribe and share this channel with your friends. Let's begin with the basics. During sexual stimulation, a man reaches a certain level of arousal, and signals travel through nerves in the penis. One of these nerves is called the dorsal nerve of the penis, which sends messages to the spinal cord in a region known as the spinal ejaculatory center. This process then triggers ejaculation as a reflex, meaning that once the signal for ejaculation begins, it cannot be voluntarily stopped. At that point, your body signals different structures that store and transport semen to contract. These include the seminal vesicles, the bladder neck, and the vas deferens, pushing semen into the urethra. The second phase of ejaculation involves rhythmic contractions of the muscles around the urethra and the pelvic floor, which help expel the semen out of the body. The volume of semen released can vary from man to man, but it generally ranges from about 1.5 to 5 milliliters. Now let's discuss the average amount of time it takes for a man to ejaculate. This timing can differ widely depending on the individual and the situation. In this case, we're specifically talking about ejaculation during penile vaginal penetrative intercourse. Researchers conducted 2 studies involving nearly 500 heterosexual couples from different parts of the world. The couples were asked to use a stopwatch or a concealed timer to measure exactly how long intercourse lasted during penetration, repeating this over several encounters during a 4-week period. It's important to note that this measurement did not include the time spent on foreplay or any other sexual activities that did not involve penetration. After analyzing all the collected data, researchers found that the average man lasts about 5.4 to 5.7 minutes. However, there was a large range of variation among individuals. So you might be wondering, if that's the average, how long do women actually want it to last? There are a couple of ways to look at this. One study surveyed Canadian sex therapists and asked them what they believed was an appropriate duration. The measurement they used is called the intravaginal ejaculatory latency time, and they described it using several different categories. It was considered adequate if it lasted about 3 to 7 minutes, and desirable if it continued for roughly 7 to 13 minutes. However, anything longer than that was often viewed as somewhat less desirable. On the other hand, when studies ask women how long they would like sex to last, and this usually includes foreplay, the total time typically falls between 33 and 37 minutes. Within that, they generally prefer the penetrative portion to last around 14 to 18 minutes. This difference between what usually happens and what people hope for can create a lot of pressure. Many men struggle with the feeling that they're not lasting long enough, that they might be ejaculating too quickly, or that they lack control over ejaculation. It's estimated that this issue affects about 20 to 40% of men, and it can become a significant concern. In fact, scientific research shows that ejaculating earlier than you or your partner would like can have a strong impact on psychological well-being and overall quality of life. Studies have found that men dealing with premature ejaculation often report lower self-confidence, reduced satisfaction with their sex life, and challenges within relationships. They may also experience embarrassment, guilt, worry, tension, or even a fear of failure. We also know that these emotional challenges don't just affect the individual, they can impact their partner as well. Unfortunately, because of embarrassment, lack of awareness about treatment options, or the feeling that it's not something worth discussing with a doctor, many men avoid seeking professional help. The good news is that there are several ways to manage early ejaculation, and some options are easy to access. For example, a lidocaine-based delay spray is an over-the-counter product that can be purchased online. You simply apply a few sprays to the penis a few minutes before intimacy, and it can help slow down the ejaculatory response. However, it's important to understand that not all delay sprays are the same. Some tend to perform better than others and may also lower the chance of transferring the product to your partner. That's one reason I often mention promescent delay spray. It's a safe and accessible option for men who want to extend their time before ejaculation, and it's something I frequently recommend to my patients. In fact, it's the only delay spray available in the United States with clinical research supporting its effectiveness. Plus, it's sold over the counter, which means you can purchase it without a prescription. They use a special proprietary formula that features anti-transfer technology, along with a metered dose spray that absorbs quickly, usually within about 5 minutes. This means you can apply it without worrying about transferring the product to your partner. Once you determine the number of sprays that works best for you, you can repeat that same routine consistently each time. In fact, a study involving 91 men found that using this spray increased the average time to ejaculation from 6.5 minutes to 11.2 minutes. That's nearly 5 extra minutes. Researchers also noticed that partners reached climax about 50% more often when this delay spray was used, making it beneficial for both people involved. That said, even though studies provide certain averages, I would argue that there isn't one correct amount of time for sexual activity. What really matters is finding a rhythm that feels comfortable and satisfying for both partners. Even for the same person, preferences can change. Sometimes people may want a quick encounter, while other times they may prefer a slower, more relaxed experience. Many expectations about sex are shaped by what we see or hear in media and society. These messages often make it seem like having sex all night is the ultimate goal. And while that might be enjoyable on occasion, it's not necessarily realistic or desirable every single time. In the end, what truly matters is how you and your partner feel about your sexual experience. That includes foreplay as well as other types of intimacy, whether penetrative or not. Sometimes the person who is penetrating, or their partner, may have unrealistic expectations about how long sex should last. Because of that, it's important to talk openly and understand what each person actually wants. Is the concern that someone isn't reaching climax, or is it simply a desire for the experience to last longer and feel more intimate? If that's the case, you might consider spending more time on foreplay or exploring other ways to increase pleasure for you or your partner. I hope you enjoyed this discussion. As always, remember to take care of yourself, because you truly deserve it.